Gage Kumar here, crushbackpain.com. Today we're going to talk about what causes lower back pain. In a previous video, we discussed this and we talked about how oftentimes we blame lower back pain on a herniated disc, on facet joint arthritis, on a muscle strain, on a pinched nerve. So basically the way we look at lower back pain is we try to determine what tissue is painful, and then we try to treat the symptom of pain by treating that tissue. As talked about in the previous video, this is short-sighted because it doesn't result in consistent, lasting pain relief. What we need to do is we need to step back, look at lower back pain from a broader perspective, and we need to determine not what tissue is painful, but what makes that tissue painful. Because if we know what is making the disc a pain generator, what's making the facet joint a pain generator, what's making the muscle spasm, what's making the nerve become pinched, if we know what's causing that, then we can address the cause and get you to the point where you don't have lower back pain anymore. Regardless of what tissue is painful, we can figure out what makes the tissue painful and then remove or modify what makes the tissue painful, and that's what results in long-term lasting pain relief. Today, we're going to go over two simple, often overlooked movements and positions that oftentimes cause tissue microtrauma and pain for people that have lower back issues. And these are simply standing up and sitting down and sitting on the toilet, especially in the morning. And these are things we oftentimes don't think about because you don't get significant pain usually when you do these things. If you have a flare-up of lower back symptoms, if your back's bothering you, you probably notice a little more pain when you stand up from sitting down, or sit down from standing up, or maybe when you sit on the toilet in the morning, but you don't think much of it. You just say, oh, my back hurts. Oftentimes what's happening is these movements, standing up, sitting down, sitting on the toilet, even sitting in general, that we do for prolonged periods, that we do dozens of times throughout the day, they are irritating the tissues in the lower back because we're moving in the wrong manner. Namely, we're moving through the spine too much and not through the hips enough. So oftentimes, if we can get your hips to move and your lower back to be more stable, which is how we're built to move, then those tissues in the lower back have a chance to heal. They don't have that constant micro trauma, they don't have the inflammation, and you get to the point where you're pain-free. Because the big picture is, over the long term, what's going to result in consistent, lasting lower back pain relief is not having the tissues of the lower back be irritated, not having micro trauma happen to those tissues, so you don't have inflammation and you don't have pain. If you continually do things and move in ways that cause those tissues to become painful, regardless of what exercise you're doing, or what injection you're getting, or what pain medications you're on, or even what surgical procedure you have, the pain's going to come back. So the foundation for long-term lasting pain relief is figuring out what makes my back hurt, and then addressing that accordingly, either taking that out of the picture, taking it off the table, or modifying the movement pattern so it doesn't cause the tissues in your lower back to become painful. So let's talk about standing up and sitting down. So something we don't even think about, we just stand up and we sit down. What's oftentimes happening, and I'm gonna sit sideways here, so I'm gonna grab this so you can see my spine from the side. So a lot of times what happens is when we go to stand up, we bend forward here, and look down here at my lower back. We bend forward here, and then we stand up. And then when we go to sit down, we do the same thing. We bend forward here, and then we sit down. So we lead with our spines. We get the majority of the movement through our spines. Our spines are built to be a rigid, solid base. Our hips are built to move. So what we should do is our spine, if we're sitting and we're going to stand up, our spine should keep that natural curve. And when we go to lean forward to stand up, we want to bend through the hips. So I'm leaning forward here, and I'm bringing my chest down towards my knees, but all the motion's coming through my hips. So I can lean forward, stand up, and then when you go to sit down, you do the same thing. You unlock your hips and you actually reach back with your body and sit. So again, I'm not moving through my back at all. I'm sitting down, I'm standing up. This is one of those things that doesn't really seem like a big deal, but you'll be surprised. If you have lower back pain when you go from sitting to standing, standing to sitting, start to move in this way. It's called a hip hinge. So you're hinging through your hips, not through your spine. If you have lower back pain with these transition movements, you'll notice you lead with the back and then stand up. You lead with the back and then sit down. You want to move in the opposite manner. Your back, you want that nice natural curve. When you're standing up, you have that natural lordosis. So you want to be here, bend forward through the hips, stand up. And then same thing, you unlock your hips and you lead with your hips. Reach back with your bottom, sit down. So in a nutshell, the lower back stays stationary. All the motion comes through the hips when you're sitting down and you're standing up. This alone will make a big difference with your lower back pain throughout the day. Because when you sit down and look at it, you're standing up and sitting down dozens of times. So you want to stand up and sit down with a hip hinge movement pattern. Now, this isn't easy to do at first. It takes some practice, but eventually it becomes a habit and it's something you don't have to think about, and it allows the tissues in your lower back to heal. It allows those tissues that are irritated to heal, and that's huge because that's what results in long-term lasting pain relief. Now, the other thing we were talking about is sitting on the toilet, especially in the morning. You wake up in the morning, your disc has more fluid, so there's more pressure pushing against the disc. Then when you get in a seated position, that increases the pressure further. So if you have any lower back pain, if you have a disc herniation, a disc bulge, you have lower back pain related to disc issues, a lot of times when you go sit down in the morning, that exacerbates the issues, sets you up for a day where you have pain. So when you go to sit on the toilet after waking up in the morning, or at any time in general, instead of sitting like this or like this, again, getting more flexion through your spine, you want to sit like this. Or if you want to lean, just like the hip hinge, lean forward with the hip hinge, keep the lower back neutral, keep that natural curve. So you want to be here if you want to lean on your knees instead of here. And if you're sitting like this, you don't want to be here, you want to be here. So again, it's just postural, but we're keeping the lower back in that neutral position to take excessive compressive force out of the disc. And that makes a huge difference, especially in the morning when you have more pressure in the disc anyways because of increased fluid content from being recumbent, from being horizontal all night. Those two things can make a huge difference with lower back pain, especially if your issue is because of the disc and you have more pain with bending forward, more pain with sitting. You notice pain when you go from standing to sitting. Incorporate the hip hinge, and when you sit for prolonged periods, stay here opposed to here. Again, you're here opposed to here, especially in the morning when you go sit on the toilet. So those are two really easy things that you can start doing today, right now, that are going to make a big difference, especially over time, because they're going to allow the tissues in your lower back to heal. Those tissues heal, they're no longer irritated, they're no longer inflamed, you don't have lower back pain. So incorporate the hip hinge with your sitting and standing, and also with your sitting for prolonged periods. Keep your chest up, keep that natural lordosis, that natural curve in your lumbar spine to allow the tissues in your lower back to heal. If this video helps you, if you like it, leave me a thumbs up below, leave a comment. Also, let me know if you have any questions on lower back pain. I'll try to answer those here on the Crush Back Pain YouTube channel, and check back every week for more ways to beat back pain permanently.